For the ones who get it done, the most important part is the one you need now. And the best partner is the one who can deliver. That's why millions of maintenance and repair pros trust Grainger, because we have professional-grade supplies for every industry, even hard-to-find products. And we have same-day pickup and next-day delivery on most orders. But most importantly, we have an unwavering commitment to help keep you up and running. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. We've got a free 31-page PDF. It's a great little study guide, review, whether you're out in practice or whether you're taking board exams or in school, taking pharmacology exams. Go get that absolutely for free. Simply an email will get you access to that, and you can go subscribe at reallifepharmacology.com. And as soon as you do that, you'll get an email with that free 31-page PDF on the top 200 drugs. So no-brainer to go get that for free. And again, do that at reallifepharmacology.com. All right, the drug of the day today is Ticagrelor. Brand name of this medication is Brilinta. And this medication is an antiplatelet agent. And it falls in the category similar to clopidogrel and prasugrel, which I have covered on previous podcasts. So you can go to reallifepharmacology.com and search those if you're looking for more info on those. But this one we're going to stick with Ticagrelor. So, knowing it's from the class of those other two agents, this is a P2Y12 inhibitor. So, mechanistically, how this works, it binds adenosine diphosphate P2Y12 receptor on platelets. And that activity ultimately causes blocking of the function of GP2B/3A complex, which that complex is necessary basically for platelets to stick together and function appropriately. So you'll often hear that referred to as platelet aggregation. They're starting to collect together and obviously start the formation of a clot eventually. Uses of this medication, acute coronary syndrome, things like STEMI, primary prevention after heart attack, potentially there as well, with aspirin, often called dual antiplatelet therapy. But there is some caveats to that, and I'll talk about that in a little bit here, particularly with aspirin. Dosing, I think, is important. So in an ACS, in an acute coronary syndrome type situation, where a patient has just had a STEMI, just had a heart attack, for example, we're going to do a loading dose in that situation if we're using Ticagrelor. And again, there's loading doses for the other agents as well, like clopidogrel, for example. So the loading dose is 180 milligrams as a one-time dose, obviously, being a loading dose. And then after that, it's 90 milligrams twice daily is kind of the standard maintenance dosing. And in that ACS situation, that's typically going to be done chronically for 12 months, that 90 milligrams twice daily. Again, we're going to have to assess that patient clinically and make sure, the dose is okay and they're not bleeding and stuff like that. But that's typically the usual course, 90 milligrams twice daily. And then at 12 months, it's typically reassessed. And if patient is very, very high risk for another event, for example, a clinician may decide to continue 90 milligrams twice a day. If that risk is not felt to be as great, we might reduce that dose at that 12-month point down to 60 milligrams twice a day. But again, there's going to be that risk-benefit assessment at that time for sure. Warnings. So obviously it makes sense. It's an antiplatelet medication. It's designed to essentially thin the blood. So thinning it too much, we're going to run into the risk for bleed. So that's obviously one of the major adverse effects and probably the primary risk with this agent. Now, there's a really unique boxed warning, and I've definitely seen this come up on pharmacology exams and board exams throughout my career. So Ticagrelor, it is recommended to avoid doses of aspirin greater than 100 milligrams per day. So basically in practice, what you're going to see is Ticagrelor used with aspirin 81 milligrams per day versus 325 milligrams per day. So again, aspirin doses with Ticagrelor greater than 100 milligrams per day reduces the effectiveness of Ticagrelor. And I want to emphasize this point because this has come up in practice. I have had numerous patients who take aspirin for analgesic purposes. Not something I generally recommend, but some patients will really like to use aspirin, whether it's what they have laying around the house or whatever the case may be. Really, really important to ask about aspirin use. It's going to be important with anybody on antiplatelet, anticoagulant, because it's going to increase bleed risk, obviously. But in patients on Ticagrelor specifically, we're definitely worried about that reduced effectiveness. If somebody's taken, aspirin 325, 650 once or twice a day for analgesic purposes, that's going to cause potentially the same issue. Where it's going to reduce that effectiveness of Ticagrelor. So really, really important patient education point and a discussion that you need to have with your patients as well there. So adverse drug reactions, kind of following up on that, bleed risk, of course. Dyspnea has been reported at low percentages. There has been GI upset, things like that. So again, it's generally not crazy high as far as adverse effects go. Other than that bleed risk, which we're obviously going to monitor in anyone that's taken an antiplatelet agent like this. And then I did want to mention risk goes up for an event, a cardiovascular event like heart attack, if it's abruptly discontinued. So pay attention to patients with a poor track record of adherence where you're concerned, maybe they're not getting their medications refilled on a timely basis, or maybe you just know from, patient interviewing and asking them, maybe they're notorious for forgetting to take medication. So that risk can be increased, obviously, when we abruptly stop a medication like Ticagrelor. So again, very, very important patient education point there. Don't just willy-nilly stop taking this medication because it could result in some significant cardiovascular issues there. Monitoring parameters, bleed risk, so hematocrit, hemoglobin is probably going to be your primary thing we're going to monitor there. Cost is an issue potentially for some patients with Ticagrelor, so that's something to pay attention to, making sure they have adequate coverage, making sure they're not, rationing it, like, going back to the skipping doses, things like that, making sure that if it is prescribed, that there is adequate coverage, because it's definitely significantly more expensive than clopidogrel, at least at the time of me making this podcast. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCMTMS, BCPS, ambulatory care, psychiatric exam, or the geriatric exam, go check out meded101.com/store, S-T-O-R-E. We've got a growing list of resources there, literally helped thousands of pharmacists pass their board certification exam now. Also, we've got Naplex content. If you're a student, definitely go check that out, support the sponsor, including a free brand generic quiz. You can go check that out, Google search that and find that. And then if you're a other healthcare professional, nurse, med student, PA, nurse practitioner, I've got a great list of resources, Amazon books, Audible books, perils of polypharmacy on case studies and drug interactions. Lots of different resources that can be helpful to you, including our recent release on nursing pharmacology and a book on that. So go check out all those links, meded101.com/store, and definitely support our sponsor. All right, wrapping up with drug interactions. So first thing I always think about with ticagrelor and any antiplatelet agent is the bleed risk. So if a patient's taking NSAIDs, if they're on an anticoagulant, this is going to increase their risk for bleeding. Okay, so it's just something you got to pay attention to, something you got to monitor. And obviously, we're probably going to want to avoid, a drug like NSAID for pain management in a patient taking antiplatelet meds, because that GI bleed risk is definitely real and potentially an issue there. CYP enzymes, I definitely want to mention this. Ticagrelor is a prodrug similar to clopidogrel. However, ticagrelor uses a different CYP enzyme. So clopidogrel uses CYP2C19. Ticagrelor uses CYP3A4 and CYP3A5 as its primary enzymes that activate the drug. So as you can imagine, especially strong inhibitors, strong inducers of CYP3A4, I think of inhibitors being, something like grapefruit juice, inducers being something like carbamazepine. This could potentially alter that enzymatic process and that prodrug activation. So if you know a patient's taking, one of these, it could definitely interfere with that process, and that definitely needs to be a risk-benefit discussion with using ticagrelor versus maybe one of the other agents like clopidogrel or prasugrel. Okay, so definitely think about that when we're selecting ticagrelor. Morphine interaction does potentially reduce the effectiveness of some of the P2Y12 inhibitors, and I would include ticagrelor on that list. So that's something to pay attention to for sure. And then ticagrelor may increase the concentration of certain statins, and maybe some statins more than others. So simvastatin or torvastatin may be a little more likely to have their concentrations increased by the use of ticagrelor. All right, well, I think that's going to wrap up the podcast for today. Thank you so much for listening. If you'd do me a big favor, leave a rating and review on iTunes or wherever you're listening. That's greatly appreciated. Obviously, go sign up at reallifepharmacology.com. Get that free top 200 study guides. No-brainer. All it's going to cost you is an email. So definitely go take advantage of that. Support our sponsor, meded101.com/store. Your Amazon purchases and other purchases there go to directly funding this podcast and my time in being able to do that. So I greatly appreciate that. If you want to reach out to me, mededucation101@gmail.com, or you can track me down on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. With that, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.
At Grainger, we're for the ones who specialize in saving the day, and for the ones who've mastered the art of keeping business moving. We offer industrial-grade supplies for every industry, with same-day pickup and next-day delivery on most orders, all backed by real people ready to help. So you can get the right answers and products right when you need them. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.